Hi, I'm Dr. Marvin, and I'm a holistic health psychologist in California. I'm in two practices in Fresno and one in Monterey, where I live. And I'm starting a 6-week rollout session for 6 different topics that pertain to mental health. So a lot of times people want to know, how can I get better sleep? How can I have better stress management? How can I effectively communicate with my partner? So that's some of the topics that we'll be covering over this 6-week cycle. So the first one that seems to always hit people the hardest is that of getting better sleep. So depending on which professional you go to begin with to let them know that you're having bad sleep will sort of determine the outcome of your treatment. So for example, if you went to a medical doctor and you said you had poor sleep, you'd probably be prescribed a medication like Ambien or some sort of melatonin, and then you'd be on your way. If you went to a chiropractor, they might let you know that there's some things that are out of alignment and they might adjust you, and that might help you to sleep better as well too. A couple of other different practitioners are going to tell you different things, and then certainly mental health might say, well, you're probably not sleeping because your mental health is out of whack, which could certainly be true too. But as a holistic practitioner, I like to look at things from all different perspectives. So I agree that a lot of these things might be a problem, but you get to be the judge of determining which one you're going to be able to fix the easiest, but also looking at things from a holistic perspective. So when I talk about sleep hygiene, which is what we kind of officially call it, we look at a couple different factors. We look at the first one being physical issues in the bedroom where you might be sleeping, and then the other one is the mental health issues. So with the physical issues, I always encourage people to think about what is happening in your bedroom that may have nothing to do with you not being able to sleep in your head. So for example, if you have lots of animals in bed with you, you can't kick out your kids, your partner is, sleeping in a weird position all the time, or they snore, or they get up a lot, or maybe they get up to go to work and you don't. So there's a lot of different factors that might contribute to why your sleep is not good, but from a physical perspective. So really think about those things. Another issue for a lot of people is noise. So perhaps you're in a house with a lot of other people and they make a lot of noise at various hours, or you are living on a busy street, or you are in a situation where there's people next door that you can hear. So I encourage people to do white noise machines, headphones, noise canceling things, something that helps you sleep better if you're not able to move out or away from those noises. So being prescribed a sleep medication when you might be able to fix this in a different way may not be the most effective thing, and in the long run you're going to be putting more things into your system that maybe you didn't need to put in. So another thing is that of a mattress. So is your mattress maybe 15 years old? Does it go back to when you were living with your parents? Is this your college mattress? It might have bad vibes associated with it. Maybe it's just really uncomfortable, or maybe it's too small and there's 2 people in your queen size bed and that's not big enough. So really think about that mattress, that bed that you have, and perhaps you could get a bigger one or a different mattress, and that might help you sleep a little bit better too. So the fourth one, which is kind of challenging for me to do, is letting go of any sort of electronics at least an hour before bedtime. And I know that's almost impossible for a lot of us. But what's actually happening, and maybe when you hear this it makes a little bit more sense, but what's happening is when we have those blue lights go into our eyes through our retina, and it hits our brain, that blue light lets our brain know that it should not be producing melatonin. And melatonin's our sleepy drug. So if our brain isn't producing melatonin, then we're not probably going to sleep very well. And once you continue to do this every single night, it becomes a bit of a routine, and you think you have to have your YouTube, you have to have your TV on, you have to have your cell phone to help you fall asleep. And it probably does make you a little tired, but it doesn't always knock people out. And you might wake up 15 minutes later, 2 hours later, enough to where your melatonin isn't doing its job. So there are apps where you can purchase, and there are some for free, that get rid of the blue light. And one of the more popular ones is called Night Shift, so you might want to check that out. And then in the morning time too, when we get up, we sometimes don't want to open up the curtains. We want to keep everything nice and dark. Well, this is where we want to stop melatonin production. So if it's all dark in your house, you're probably not going to stop that melatonin production, and you're going to be still producing it and still a little bit sleepy. So melatonin needs to flow at nighttime, and it needs to stop first thing in the morning. So those are some of the physical reasons why people might have some difficulty sleeping. There is kind of an in-between category of the physical stuff in the environment and then the mental stuff, and that's what you put into your body. So if you are drinking caffeine, or you're exercising, or eating super spicy food before bed, your poor body has to take that into consideration, and it has to kind of work hard while you're trying to sleep. So maybe cut out certain things. Maybe you can't have coffee or sugar after like 2 o'clock in the afternoon, which is not fun, but if you want that good sleep, then you may need to really consider that. So the last one is, or the bigger part, I guess, for me with mental health, in the last portion of this 2.5 part sleep hygiene portion, is that of mental health. So having bad sleep doesn't necessarily make you a mental case, but I think we don't feel super good the next day, so it does kind of become a mental health issue, and you start maybe dreading going to bed at night and wondering, oh my gosh, am I going to get a good night's sleep? And we keep looking at the clock and doing like some pretty crazy statistical equations, thinking I've got 3 hours left, now I've only got 2, can I survive off of 2? Is this really going to work? So we start kind of being afraid of going to bed. So with the mental health stuff, what I always tell people to do is think about what you're thinking about. So if you're laying in bed just having, all the day's chatter go through your mind, that's kind of normal. A lot of people have that. But there may actually be something in particular that you're focusing on. So you might be focusing on a family issue, a partner issue, your children, maybe it's finances or your job. So really take into consideration what you're actually laying there stressing out and ruminating over at night, and then work on that. And taking a medication, again, time and a place for medications, but taking a medication to help you sleep because you're kind of stressing out about something else isn't going to be very effective in the long run. So consider that. So one thing that can be helpful is actually writing down all the things that are flowing through your head. So you're just kind of writing stuff down, like I'm thinking about my bills, tomorrow I got to do this, I have to call this person, get new tires, whatever it is that's going and banging around in your head at nighttime, write those things down. And it gives your brain permission to chill out. You're saying, I got you, brain, we'll focus on this some other time. So it helps you take a little bit of a break. And it doesn't have to be legible handwriting, you're not turning it into anybody, but at least it gets it out of your system and onto paper. So those are 2 little tricks. So thinking about what you're thinking about and trying to work on that, maybe in the waking hours, and then doing a to-do list, writing down everything bouncing around in your brain. And a third one is just being mindful, laying in bed and thinking about just nothing, or thinking about stuff you smell or things that you, hear. If hopefully you're not hearing a lot of things in your sleep or when you're laying in bed going to sleep. But it's mindfulness activities can be super effective when you're trying to not think about future stuff, which gets us wound up, and thinking about, could have done that earlier today, should have done that yesterday. So neither of those places are good places to be. So we want to be here and now. And one of the oldest tricks that our parents taught us is probably counting sheep. So when you can't sleep, count sheep. Because you're actually focused on the here and the now, right? You're not really thinking about other things. You're just thinking about sheep jumping over a fence. And that's easy. And that gets you to go to sleep because it tames down or tones down the thoughts of the future and the thoughts of the past. And that's a really nice place to be. So those are a few little tips and tricks. Clearly it's not going to be fixed overnight. If you are needing a little bit more information, feel free to email or call me or message me. All my information can be found on my website at drkmarvin.com. So drkmarvin.com. You can also find me on Facebook under the Whole Body Wellness Center. You can like my page, and I do little informational updates every once in a while. Come back and subscribe to this channel, and I'm going to be doing the other mental health points coming up in the next couple of weeks, and hopefully this has been helpful for you, and you can reach me through one of those particular areas of your choice. All right, take care and happy mental health to you. Bye!